faces, which is wonderful. I want to welcome you to Gathering Point, which is our monthly luncheon. And this year, our North Luncheon is hosted by Miller's of Castleton. They're right around the corner. So we have two representatives here from Miller's that will talk about their services and what they have to offer. And then we have Sarah Waddle here from AARP, and she will talk about the healthcare law and how it pertains to people on Medicare and what changes are coming or have came that you're not aware of. I want to let you know next month our topic will be what is Alzheimer's disease. So again, we'll be at noon on the second Wednesday of the month. We should be back in our normal room at the 7250 building, but there was a different group that needed the room and it was full of leaders, so we shifted to this room and it's worked out very well. And again, we'll have lunch that will be sponsored by Miller's again. On the 27th of March, if you are a veteran or you have a family member or a spouse that is a veteran, or if you're a surviving spouse of someone that was a veteran, we have a veterans class here on the North Campus at the Vascular Hospital next door. So she'll talk about different opportunities and benefits that may be available to you that you may not be aware of and how to go about getting those. So again, the flyer is up here and it has the little American flag on it. And then ladies, we do have our Mother's Day tea coming up if you haven't signed up yet, or if you haven't been before. It's a wonderful afternoon. We raise funds for our different programs, specifically our meal programs. So we'll have a fashion show, we'll have women's health speakers, we'll have a silent auction, and then we also have different vendors there that have some products for women. It's a fun afternoon, so we wear hats and get all dolled up. So I will turn over to Miller's, and then Sarah. Thank you.
Thanks, Victoria. Nice to see everybody today. Is everybody enjoying the lunch so far?
Yeah.
Thank you. I know that's one way to, we'll take that.
He didn't make it, no.
I know that's one way to get people to come out and listen to some information. Yeah. We're very excited to be here. We've been participating in this event since January, and we're glad to be one of the sponsors for this particular hospital. My name is Charlie Smith. I'm on Miller's Healthcare Development and Marketing team. This is Stacy. She's one of our administrators. We know you're going to hear some great stuff today from AARP about healthcare reform and Medicare. Stacy's going to tell you a little bit about our organization, but I just want to thank you for coming out, and I hope you enjoy yourself.
Thank you.
Hi, I'm Stacy. I'm actually the administrator at the Castleton building right now, filling in for the other administrator who's currently on her maternity leave. But as you can see from here, we have over 30 different nursing facilities all across Indiana. We are only located in Indiana. Hopefully you guys maybe have heard about us before. Here in Marion County, we have the Castleton building and the Indy East building, which is on the east side. We have also some assisted living. The Castleton building does have assisted living, so that's connected to the same building. What we have to offer in our nursing facility, we have rehab, stays, we have some private suites and different things. So if you had to go to the hospital, have a surgery, just needed some rehab before you needed to go home, which you'll probably learn more about what covers that and Medicare and different things hopefully a little bit later today. But we do have the private suites. We also have our own therapy company, which is in all of our buildings. That's TheraCare. And then we also offer Miller's Home Health Solutions. So after you get done with your rehab, if you are ready to go home but maybe need a little bit more help, we offer that. So Miller's can kind of help follow you through the process. So that's a really nice thing. Up here, if you haven't already been up here, we have a few different things, some senior events that our assisted living puts on. So you're more than welcome to grab one of these. We do a monthly community bingo, we do brunches, different baked potato bars, so different lunches. So if you're interested in any of that, please grab one of these. Is there anything else you can think of that?
No, we'll be here as long as you guys will be here, so if you have any questions about anything, or you just want to just talk about basketball or whatever. We'll be here.
You a basketball fan?
Oh, absolutely.
Pros or?
You said pros?
Yeah, pros or college?
Oh, pros, college. It's just basketball.
It's just basketball.
Little kids, it doesn't matter.
Exactly where is your location here in Castleton?
We're at 8400 Clear Vista Place. You can see us from 69 if you're heading north on 69, but you have to kind of go the back roads to get to us. So go down 86th Street and then you should be able to find us.
Okay.
Okay.
I heard one.
Okay.
Yes.
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 Right there in the corner,
Nope, that's
No.
Castleton. We're if you go right down the road.
Right.
Yeah.
toward 69.
Yes.
Yeah, okay.
Yes. Where you turn right off of Hague Road on 86, and you have to just drive down 86 a little bit, and then we're back there. So.
One day I think they're gonna make a little beeline or something from 69 so you can get straight to
We're easy to see, just hard to get to.
Oh, we're always paying for something.
I'm ready. Are you all ready? All right. Hello, everyone. We can do better. Hello, everyone. Hello. All right. My name's Sarah. I'm a staff person with AARP here in Indiana. We have about 850,000 AARP members in the state of Indiana. We have a staff of 7. Kind of a pretty unbalanced ratio if you ask me, but we're very lucky to work in partnership with volunteers and communities across the state. We work in the areas of health and supportive services, financial security, and something called livable communities, making our communities better places to age. We do that through advocacy, so public policy, and we do that through education and outreach. So today I'm here to talk to you about the Affordable Care Act and how it impacts those that are on Medicare. So first of all, before we get started, just want to kind of take a little survey in the room. Is everybody in here on Medicare? Is there anybody who's not on Medicare? Okay, so there are a few of you that are on Medicare, and that's good because I have a little bit of information related to how the Affordable Care Act is going to affect society as a whole, because I know you all have children and you have grandchildren that aren't on Medicare, so you might be able to learn something here as it's going to pertain to them. And then if you're on Medicare, I'll have some more information related to how it's going to impact you. When I say Affordable Care Act, what's the first word that pops into your head? Obamacare. What else? Affordable. What else? I heard somebody. Scary. Not affordable. Scary, confusing?
Out of pocket. Hello.
Out of pocket. Anything else? All right. How many of you feel like you know what's going on? Okay, a few of you, and that's good. I'm here to tell you it's not scary. For those of us that are going to be on Medicare, it's a good thing. Okay? It's a good thing. So we're going to talk about it today. I think we're a small enough group. If you have questions, just raise your hand and I'll try to answer them as we go. I'll try to answer your question. I'm going to put a little asterisk next to that because I'll do my best, but it's a lot of information and everybody has a pretty specific case as it pertains to them. So if it gets to be too weedy, I'll just ask to talk to you offline after my presentation's done. All right? So you have some handouts in front of you if you picked them up over on the table. You actually have the slides that I'm going to go through here today. You have 2 other pieces of information that are probably going to be more helpful than I am. This is a brochure that AARP has put out that goes through how the healthcare law impacts those of us on Medicare. And then this was in the AARP magazine last fall, and it's the big myths about Medicare and healthcare reform. Every day I get some sort of email from one of my volunteers saying, I got this, is this true? And most of the time it's not. There's a lot of scary stuff out there. And when you read it, you're not sure to know what's right and what's wrong. And so there are a lot of those that are in here. You can read through this and get the right information. We're just going to briefly cover what the law means for people with health insurance and those who are uninsured or buy their own coverage. And like I said, for your children and your grandchildren, you might pick up a little nugget of information. If you're not interested, if you're on Medicare and you only want to know what it means for you, then you can tune me out and I'll tell you when to tune back in, okay? And then finally we'll talk about those who have Medicare. All right. So last June, the Supreme Court ruled that the majority of the critically important provisions of the Affordable Care Act are constitutional. So what this means is that the court ruled that the individual mandate is constitutional, and this is the provision that requires all Americans to have health insurance. Okay? That was upheld. The only part of the Affordable Care Act that the court found unconstitutional was the requirement that states must expand Medicaid to reach more low-income people. And so states have that option, which they're going through that process right now in what they're deciding. But before we move forward, what's the difference between Medicaid and Medicare?
Age.
Medicare is what? 65 and over is Medicare, all right? Medicaid is for low income, all right? Okay, it's income-based. All right. So the first group we're going to talk about are people who currently have health insurance. So we're mainly talking about people under the age of 65 who get their health coverage through an employer for the most part, okay? Employer-based health coverage. What does it do? Insurance companies can't drop coverage if you get sick, all right? So a lot of discriminatory insurance practices. For instance, as long as you continue to pay your premiums, health insurance companies cannot drop your health coverage if you become sick or disabled. There are also protections in place to limit increases to insurance premiums. So insurance companies must now justify any rate increase over 10%. Okay, they have to justify that. Another important change is that children under the age of 19 cannot be denied health insurance because of a pre-existing condition. That's in place now. So if they have diabetes, heart disease, a pre-existing condition, they cannot be denied coverage if they're under the age of 18. By 2014, so next year, that's going to apply to everyone. So you cannot be denied coverage for a pre-existing condition. Coverage limits. Eliminates coverage limits. It makes limits that an insurance company can place on your coverage, so it makes changes to that. Before the law was passed, some insurers could limit how much they pay for care during the year and over a lifetime, okay? So once your insurance coverage ran out, you would either have to pay out of pocket or you would just go without. And so because of the health care law, insurance companies will no longer be allowed to limit how much they will pay for your medical benefits over your lifetime. So this just gives folks a peace of mind that their benefits aren't going to run out when they need them most. So insurance companies can't place lifetime limits on your coverage. That isn't in place now. And then come 2014, so next year, insurance companies can no longer place annual limits on your coverage. Preventative services. This is another change, another positive change in the area of preventative health services. Most insurance plans, including Medicare, which we'll talk about later, must now cover proven preventive benefits such as immunizations and screenings, so your flu shots, screenings for diabetes, certain cancers, mammograms, colonoscopies. Okay. Let's talk for just a minute for those folks who are uninsured or they buy their own coverage. So they're not getting their insurance through their employer, but this is still focused on people who are under 65, okay? All right, so if you are uninsured or you buy your own coverage, the health care law will make it easier for you to buy health insurance. If you're an uninsured individual, you're self-employed, you own a small business, you will be able to purchase health insurance through what's called a health insurance marketplace. Until recently, these were what was termed the exchange, the health insurance exchange. Have you all heard that term? Okay. And this is where it gets confusing for a lot of people because they don't know what this means. Essentially, this is like a web portal. How many of you shop on Amazon.com? Okay. So it's like an Amazon.com for health insurance. Okay. It's a web portal. It's going to work a lot like, for those of you who do your Part D shopping online and you use the drug comparison tool finder, and it just helps you determine what you need and then looking at how much you want to spend, and then it will give you kind of a menu of options to allow you to compare products and make it easier for you to shop. Okay? Yes, sir.
If you're uninsured in 2013, are you required to have insurance?
No, that's not until 2014.
2014.
Yes.
Okay,
Yeah.
appreciate it.
Starts in 2014, all right? So there's a lot of work going on right now at the federal level and at the state level trying to get this all put into place, because enrollment for the health insurance marketplaces this fall are when they're supposed to be up and running to get people into the system starting in 2014. Okay?
Well, what about in 13? As far as the state, I know they were offering some insurance.
Yeah, there are some.
Is that still available?
Well, I think if you're not in the system now already, that's not true. There's a federal plan that I think you can still get on if you are uninsured. And then there's the state plan, which I think because it's going to phase out once this becomes into place, because there's not going to be a need for it anymore. But there are some abilities to get coverage for the remaining of 2013. The remainder of 2013.
I'll be 63 in September. I retired last June, and so I'm kind of in limbo.
Okay, let's talk. Yeah.
And I'm on Medicare.
Mm-hmm.
She's disabled.
I'm disabled.
Right.
And so I have the Medicare plan and a private plan for him.
Yeah, which is quite expensive, yes? We'll talk afterwards and I can give you some information, okay? All right. Creates a health insurance marketplaces. So this is, again, what's going to happen in 2014. The good thing about these plans is they're all going to offer a core set of benefits. So every health insurance plan that is on this marketplace has to cover a minimum set of services, okay? And then beyond that, the more you pay, the more services you can purchase, okay? So there'll be different levels of coverage. These are private plans. These are not run by the government. They're private plans, and you will get to choose which one you want. The Affordable Care Act provides help for paying for insurance for those who are uninsured and buying their own insurance starting in 2014. And these are for the products that you're buying through the marketplace. You may be able to get a tax credit or a subsidy based on your income, okay? Some of you might be aware of this. If family members have been able to take advantage of it, extends coverage to young adults. Adult children can stay on their parents' policy until they're 26 years old now, which is very helpful when your child is in college or just getting out of college, trying to find a job. They may not be able to find a job that has health benefits. Even if they don't live with you, even if they're married, even if they're no longer in school, if you have a family policy and they don't have access to health coverage through their employer, they can stay on their parents' plan. All right. That would have been really nice when I was really nice. I just went without and just kept my fingers crossed. Yes?
Can they live out of state and still get that?
Mm-hmm. There might, depending, you just need to check with your insurance company to see what their coverage is like, but yeah. Option for states to expand Medicaid. This is the part of what the Supreme Court determined was unconstitutional. We couldn't require states to expand Medicaid, so they have the option to expand Medicaid, again, starting in 2014, and it will be based on income limits. So Medicaid, the Affordable Care Act wants to expand Medicaid coverage up to 138% of the federal poverty level. I know that doesn't mean anything to you, but it's pretty minimal income. I mean, we're talking like $15,000 for an individual that they'll be able to qualify for Medicaid. Indiana is one of the states right now that's in the mix as far as trying to figure out what they're going to do. If you follow that news, Governor Pence isn't supportive of just expanding traditional Medicaid. He wants to do it through what is known as the Healthy Indiana Plan. That we have to get permission to do that. So there's still a lot to be determined in the state of Indiana as far as what this is going to look like.
Is Medicaid just based on income, or is it I always heard something about you had to have kids under 18 or something to be on it.
Well, in Indiana, currently, Medicaid is a very limited group of people. It's for those who make less than 24% of the poverty level, so you make about $5,000 a year. But childless adults typically don't qualify for Medicaid. It's if you have children, so that's where that's coming from. Okay. All right, so if you haven't been listening, turn your ears back on, because this is the part that really matters, okay? We're going to talk a little bit about what this means for people with Medicare. So how many of you aren't sure whether or not you need to purchase insurance on the health insurance marketplace? You don't need to. You've got your Medicare, you probably got a supplement or Medicare Advantage plan, you are okay, all right? You're done. Check that box. All right. The Affordable Care Act does improve a lot of things for Medicare beneficiaries. First and foremost, the health care law aims to improve Medicare by lowering the cost of the program. So in other words, the law requires Medicare to spend more wisely. The savings that will result from this will help keep Medicare financially stable for longer, about 10 years, okay? We're looking out to like 2024 right now, I think, is, Medicare's, which that's not that far away, but it's longer than it was before the Affordable Care Act. So if you have Medicare, your guaranteed Medicare benefits are protected. So this includes your doctor and your hospital visits, rehab services, and this is true whether you have original Medicare or you're on a Medicare Advantage plan, okay? You will also receive some improved benefits. For example, the improvements to Medicare will lower your out-of-pocket cost for prescription drugs if you hit that dreaded donut hole. Are there folks in here that are familiar with that donut hole? It's not the good kind of donut hole. The one that we like to eat is the bad donut hole. All right.
This will start next year.
Well, this is actually started, so we'll talk about this in a minute, okay? The other thing that it does is it expands your preventive benefits that you receive in Medicare, okay? So let's talk about the donut hole. Just to cover what the donut hole is all about, this is the coverage gap, the Part D coverage gap that's out there. So this year in 2013, you fall into the donut hole when your out-of-pocket drug costs exceed $2,970. Okay, so that's what you've paid, not what your insurance company's paid, but what you've paid towards your prescription drugs. Some people hit this really fast if they're on an expensive prescription drug. Okay, you leave the donut hole when your total drug costs reach $4,750 that you've paid out of pocket. And then you go into the catastrophic coverage benefit. All right? I know that's very confusing. So I have a pretty diagram for you. Yes, sir?
I thought that $2,970 was both you and your insurance.
No, it is what you have paid. It is your copay. Yeah, and it's not your premiums. It's your copays, deductibles, and co-insurance. It's not your premium, and it's not what your insurance company has paid. Okay?
It does read that way. It's very confusing.
It does read, yeah.
It does read that way.
It does read that way.
The combined effective 6 weeks.
The insurance guy that I bought my supplement insurance from told me that that's how it was calculated. It should be here.
Yeah.
They want to get your thing in Medicare.
Yes, ma'am.
So, my understanding is that if I'm on Medicare, which I take 33 different medications a day, okay, but with my Medicare plan, I can have that supplement that's going to help me with that $2,975.
The Part D?
Right.
Okay.
Part D. Now, can you not buy a supplement over here to help you with your that donut hole?
Well, some Medicare, we'll just have to talk offline, because some Medicare Advantage plans have some coverage in the donut hole. Typically the traditional Part D plan, so if you're just buying a Part D plan, I guess some of them may, but I'm not familiar with ones that provide coverage in that donut hole. You're responsible. So this initial benefit where you pay your deductible and 25% of your drug costs until you reach that $29.70, and then you hit the hole where you're responsible. Before the Affordable Care Act, you were responsible for 100% of your drug costs in that donut hole, right? So what happens? A lot of people quit taking their drugs, right? Because they can't afford them, right? So what the Affordable Care Act does is provides a discount now when you're in the donut hole, discount for 52.5% for brand name drugs, 21% for generic drugs, and that will go up every year, okay, until in 2020 where there's no longer a donut hole, all right? So that's what's going on there. So next year, huh? Well, yeah, a lot of folks would like to see it close a heck of a lot faster, but so that's your coverage, what it looks like for 2013. And then
Is Medicare, or is that part of the other program?
this is just Medicare,
So in next year, that'll start?
and it'll gradually increase each year. I think there is a timeline.
Until
2020, yeah. I think in the back of this handy book here, there's a timeline, and it will tell you each year what the donut hole coverage increases to, okay? All right.
Excuse me, one question.
Yes, sir.
When you talk about the out-of-pocket expenses, you said that included co-pays, prescriptions. Would that also fall under like CPAP machines, things like that?
Part D is just prescription drugs,
Okay.
from what I understand. Yeah.
Okay.
Yeah, I think those types of things will fall under a different part of Medicare.
All right.
So, yeah. Yeah. And when you reach the $4,900 on the other side of the donut hole, you get into this catastrophic coverage where you are then just responsible for 5% of your drug costs for the remainder of the year. Okay? So this is a good thing for Medicare beneficiaries. I know it still feels like there's a big hole, because there is, but it's a smaller hole than what it was. Okay? And it will get smaller every year. All right, so 52.5% help with your discount on brand name drugs, 21% on generic drugs. By 2020, the donut hole will disappear. When the donut hole disappears, you're still going to have your cost sharing where you'll be responsible for 25% during your initial benefit and then the 5% in the catastrophic coverage. You just won't have that hole in the middle, okay? AARP has a tool. I know there are a lot of tools out there. You just got to find which one you like best. Medicare has a great tool. AARP has a donut hole calculator. It doesn't calculate how many calories are in donut holes. It calculates when you're going to reach the donut hole. It might give you some suggestions on different drugs that you might take to help with your situation. All right. Any more questions about prescription drugs and donut holes? Yes, sir.
I find this whole prescription drug thing to be like a nightmare in terms of trying to determine where I can get the drug the cheapest. You know, I'm frustrated. You know, I mean, I have to go to CVS and I say, how much is this going to cost me? And then I have to go to Costco and ask them the same thing, and you got to fiddle around.
So it's a good thing you're retired, right? Because
it's just frustrating.
It is. How many of you are familiar with SHIP? Have you heard of SHIP before?
They don't know.
Okay. Yeah, Senior Health Insurance Program, and they're volunteers that are trained to help you navigate through this. Some people find them beneficial, some people don't. Some people find their children and their grandchildren are good, you know, resources to help them with some of the tools that are on the computer. How many of you use the Plan Finder on Medicare.gov? Yeah, that I've heard really good things about that. But I hear you. It's not easy. It's not easy. I'm helping my father-in-law right now navigate through all of this, and I feel like I have a little bit of knowledge about this stuff, and it's still hard. It's still hard.
Well, I think all these drugstores, they want your business,
Yeah.
and you know, I think that's why it's like that. So you just got to be diligent.
You do. You have to be diligent. Let's talk about more good things for you all. Preventive services. hang on, I skipped one. Let's go back. Preventive services. So you will no longer have to pay for Medicare-approved preventive care services. You will also be able to work with your doctor on a personalized prevention plan to keep you as healthy as possible. The additional preventive benefits started in 2011. So these are already in place. So if you're not taking advantage of them, you need to get on your dock, all right? These benefits include a yearly wellness visit. This is not a physical, this is a consultation. Screenings for diabetes and certain cancers. This will also start covering, mammograms, colonoscopies, everything that is preventive. So in your little handbook that you get every year from Medicare, there's a list of these free services. They have little apples next to them in your book, and so you can go through and you can look for the little apples, and that will tell you the services that are available to you at no cost. There's no co-payments and no deductibles associated with those preventive benefits, all right? And then you also get that consultation with your doctor every year. Just talk about what you need to be doing to stay healthy.
But what's the difference between that and a physical? You don't get from this wellness visit, you don't get any tests or anything like that?
Right. Well, what this is, I think the best way this has been described is they don't touch you during this visit. Okay? So that's coded differently if they touch you. All right, so this is a consultation. This is a chat with your doctor, a check-in, okay?
Can they be tied in with your physical?
Probably. I just talked to your doc about it, how they want to handle it. All right. Improves access to primary care doctors. How many of you are nervous about doctors not taking Medicare? Does that we live in a metropolitan area for the most part, so we're pretty comfortable, but when I'm out in rural communities that have 2 doctors, in where they live, they get a little more nervous about doctors not seeing Medicare patients and not having access to a doctor. So the other part of this is that with all of these new folks that are going to be taking advantage of the health care system, is there going to be a strain on primary care doctors to provide services for people. So you want to be sure that you continue to get quality health care, and you want to know that doctors are going to be able to provide that. So the law addresses some of these needs. Primary care doctors who treat people with Medicare will get a 10% bonus payment, and so that will give them a little bit of incentive to continue to take Medicare. And then in areas where there are these doctor shortages, Medicare will also give even extra payments to physicians and nurses who provide that care. Okay? All right, Medicare Advantage. How many of you are on a Medicare Advantage plan? Okay. I want to talk about this just a little bit because I think if any area of the Affordable Care Act, a lot of the things you hear are related to Medicare Advantage plans, okay? That they're not going to be available anymore, they're taking them away, what have you. So I want to talk about this. Before we start, I want to talk about what is Medicare Advantage. Medicare Advantage plans are an alternative to original Medicare that's available. They may also be known as the Medicare Part C. So when you're reading your materials, this is what they're talking about in Part C. These plans are offered by private insurance companies, and they pay for the same basic health care services as original Medicare. Medicare Advantage plans include both Medicare Part A, which is your hospital, and Medicare Part D, which is your medical insurance. Most Medicare Advantage plans also include some sort of prescription drug coverage, and then they have extra additional services that aren't covered by original Medicare. Some of them have eyeglass coverage, gym memberships, what have you, okay?
Do they used to be called supplements?
No, supplement is different, okay? Supplement is different.
Did you say A and B or A and D?
A and B, and then most of them have a D also, okay? Now, the difference between what a Medicare Advantage does, why this, it operates like an HMO or a PPO, okay? So if you think back to when you were employed, it's a network of doctors that you can only see, all right? It's a limited network of doctors. right. How the law changes Medicare Advantage plans. So I want to assure you that your guaranteed Medicare benefits are protected within the law. You can still choose a Medicare Advantage plan. They are still available. Or you can stick with original Medicare. That choice is still yours. The healthcare law prohibited Medicare Advantage plans from reducing or eliminating your guaranteed Medicare benefits. They cannot take those away from you. You will still have your choice, and you will still have the ability to have Medicare Advantage 1 year. Do you decide you don't like it, you can switch back to original Medicare. All of that still stays in place.
But there's no guarantee that you can get a, what do you call it, an F plan?
Advantage?
Once you go from an
Are
advantage.
you talking about the underwriting process?
Yeah.
It just depends on what you find, yeah.
You can get that way if you're willing to pay for it.
If you want to pay for it. Yeah. So the healthcare law keeps Medicare Advantage plans as an option for you to choose. It does, however, set up some new rules that will result in significant savings to the Medicare program overall. So these are the changes that they've made to Medicare Advantage. There's been a rating system put into place for Medicare Advantage plans where the plans will get bonuses for providing quality care. It's a star rating system. I think it's like a 5-star rating. You can go on Medicare.gov and you can look at your plan, your Medicare Advantage plan, and how they rate. If they get those extra bonuses, they need to put those dollars back into your care, okay? I talked about that. They cannot charge more than original Medicare for certain services. So like chemotherapy administration, dialysis, skilled nursing care, they can't charge more than original Medicare. That's a change. And then starting in 2014, Medicare Advantage plans must limit how much they spend each year on administrative costs. For each dollar they get in premiums, Medicare Advantage plans may not spend more than 15 cents on the dollar on administrative expenses. So 85 cents gets spent on you, 15 cents gets spent on them. I would hope that it would be more, and I'm scared to think of what it was before that, but we're not going to go there. All right? Currently, Medicare pays subsidies to private insurance companies that offer Medicare Advantage plans. So this is how these plans are paid for. When you opt for Medicare Advantage plan, Medicare pays a subsidy to these private companies. So what's happening is these subsidies are going to be lower to bring the payments more in line with original Medicare. Last year I think we were paying about 14% more as taxpayers for those on Medicare Advantage than those on original Medicare. And so the Affordable Care Act brings these more in line with original Medicare. And so some of the Medicare Advantage plans may react to that and make changes to their plans, which is what people are feeling. So some may drop the extra services like the eyeglasses and the gym memberships. Some plans may raise their premiums and their co-payments, and others may decide to leave the Medicare Advantage program, okay, but that choice is theirs. So if you're somebody who's on a Medicare Advantage plan, changes take place, you will receive a notice of any changes if they decide to go remove from the Medicare program. You can switch your plan, you can go to original Medicare, and I don't think that the underwriting process is involved in that. Okay, so if your Medicare Advantage leaves, you should be able to get a supplement.
So they can terminate it.
Yeah. Well, yeah, I don't think they're going to do it during the year, but come open enrollment time, you may not see them show up again. Okay? All right. There are still a ton of Medicare Advantage plans available in Indiana, but that's what a lot of the hubbub is about, related to the Affordable Care Act and how they impact Medicare Advantage plans. Okay? Other changes to Medicare, income-related premiums on Part D, which is the prescription drug benefit. We already see that on Part B. Your your medical coverage. Okay, so the Part B income levels for higher premiums start at $85,000 for a single person, $170,000 for married couples. If you fall into those categories, you're going to have to pay a little bit more for your Part D premium. That's a change. Reducing waste, fraud, and abuse. There have been some pretty significant resources put into cutting inefficient care, identifying fraudulent providers, reducing overpayments to insurance companies, and protecting personal information. We know that there are problems within the Medicare system, so the Affordable Care Act is trying to address some of that. However, I think all of us have a responsibility. How many of you look at your Medicare statements when they come to make sure you were actually charged for the services that you received? Okay, that's a good thing to do, because you never know what may show up on there. And I hear all the time, well, they come so much, so long after I had the services, I can't remember. Write it down on a little notebook, and what you had done that day, and make sure it matches up when that statement finally does come. And you can report anything fraudulent that you think is going on to Medicare. So I think the takeaways from today: the Affordable Care Act helps you lower your prescription drug costs. It protects your guaranteed Medicare benefits. It improves your Medicare covered benefits. It does make some changes to Medicare Advantage plans and how they work, and reduces waste, fraud, and inefficiencies. All right? If you're somebody who is a computer person, you like to get on the computer, I think for the most part, for those of us on Medicare, we're not going to feel a lot of the changes that are coming down the road in 2014. But if you're somebody who has a child or a grandchild or in this predicament where you're not really sure what this means for you, AARP has a tool, the health law guide, where you kind of put in your status, and then it'll walk you through what's going to happen for you related to the healthcare law. It's kind of a cool tool. And then I always push the Medicare information. If you have questions about what's going on, I always encourage you to call Medicare. Okay? In addition to Medicare, here locally, we talked about SHIP, but are there some other resources that you know of or have used in the community that you have found helpful? Where else can we go for help?
Could you do that SHIP once more? I hadn't heard of it yet.
Yeah, SHIP is the Senior Health Insurance Program, okay, and it's run by the State of Indiana's Department of Insurance. So if you go to in.gov and type in SHIP, S-H-I-P, it'll take you to their website. It'll tell you all about them, and it'll tell you how to access them in your community. You can also go to SACOA, which is your local area agency on aging, and they have SHIP counselors that are available through them. Okay? Yes, sir.
SHIP used to have, maybe they still do, an office like this in this hospital.
I don't know.
They do. It's on Thursdays or something. There's big hours. Wednesdays, yeah. Right down on the main floor.
All right. Where else can you go for help?
I went to a couple of these different presentations, when they have the open enrollment.
Sure.
And they tried to pick some of those guys' brains.
Yeah.
I mean, they all want to sell their product.
Right. As long as you go, with that frame of mind that they're going to try to sell me something, but they still are a wealth of information. Yes, they are.
Weiss Research has a site, WIS, yes, I think it's 2 S's, has a site where you can go and during open enrollment. They always have it open where you can go and look at all the different programs, all the different ones, and you can help choose. And if you tell what you want, they can kind of go through and show you the ones that have what you're interested in. And they have pricing, like for a Part B, so you can find out, because they've all got the same coverage, but they're different prices, and they'll come into your area. I thought that was helpful.
Yeah. What's this?
It's Weiss Research,
Weiss
W-E-I-S-S. I think it's 2 S's. Research. And during open enrollment, they always have a site where you can go to. And if you type that weissresearch.com on there, you should be able to find it. But you can go through, and it'll even tell you the different places different ones you can get into. Have the same insurance coverage, but the price is different in your area.
All right. Well, I'll stick around if anybody has anything else they want to chat about, but I appreciate your time today. I hope you walked away with a little bit more information than what you knew before. So thanks.
If everybody could fill out the green evaluation forms, that would be very helpful to us about today's program. If you have any ideas for future programs. Again, our next month we're doing What is Alzheimer's Disease, and it's again the second Tuesday of the month at noon. And then you can register for that program the same way as today, either online at ecommunity.com/touchpoint or at the 800 call center number. That's on all of our materials. Thank you again to Millers and to Sarah.